The sound was the first thing they noticed. It was a rhythmic, uneven percussion that had become the unofficial metronome of the East Wing Emergency Department at St. Jude's Medical Center in Chicago. Click, drag, thud, click, drag, thud, to the patients, scared, bleeding, and vulnerable. It was a comforting sound. It meant help was coming. It meant Alara Vance was making her rounds. To the patients, Alara was a grandmotherly figure with steel-gray hair pulled back in a severe bun, eyes the color of a stormy sea, and hands that could find a vein in a stone. But to Dr. Julian Thorne, the sound was nails on a chalkboard. "She's doing it again," Thorne muttered, checking his reflection in the glass of the nurse's station. He adjusted the lapels of his pristine, starch-stiff white coat. At 33, Thorne was the newly appointed medical director of emergency services. He was a man of metrics, algorithms, and efficiency. He had a jawline that could cut glass, a degree from Harvard, and a soul that had been replaced by a spreadsheet. "Doing what, doctor?" asked Mia, a 24-year-old residency nurse who idolized Alara. "Dragging," Thorne sneered, gesturing vaguely down the hall. "She moves like a glacier. We are a level 1 trauma center, not a retirement home. She affects my metrics. Door-to-doctor time is up by 12 seconds this month." Mia bit her lip. "Alara has the highest patient satisfaction score in the hospital, Dr. Thorne. And she never misses a stick. Never. Speed, Mia. Medicine is speed." Thorne checked his Rolex. A submariner that cost more than Mia's car. "Watch this." Alara Vance rounded the corner. She was 55 years old, though the deep grooves around her mouth and the permanent furrow of her brow added a decade to her appearance. She wore scrubs that were 2 sizes too large, hiding the bulk of the carbon fiber exoskeleton brace locked around her torso and left leg. Click, drag, thud. She was pushing a crash cart toward Bay 4, her face set in a mask of concentration. "Nurse Vance." Thorne's voice cracked like a whip across the bustling ER. Alara didn't flinch, but she stopped. The heavy thud of her orthopedic boot ceased. She turned slowly, her movements stiff, pivoting her entire body rather than twisting at the waist. "Yes, Dr. Thorne?" Her voice was rasping, a low alto that sounded like it had been smoked over a fire. "Bay 6 needs a catheter. You've been transporting that cart for 3 minutes. A snail could have delivered it to the moon by now." The ER went quiet. A few patients looked up. The other nurses lowered their heads, afraid to draw fire. "The cart will has a jam, doctor," Alara said calmly. "And I was checking the inventory. We were short on epinephrine." "Excuses," Thorne said, walking up to her. He loomed over her, utilizing his height to intimidate. "You are slow, Vance. You are an anchor dragging this entire department down. I've seen corpses with more hustle." Alara's eyes, usually warm for patience, turned flat and cold. "I get the job done, Julian." "It's Dr. Thorne," he corrected, his voice dripping with venom. "And getting it done isn't enough. I need agility. I need vitality. Look at you." He gestured vaguely at her left leg, the one that looked thicker than the other beneath the fabric. "You're a liability. If a patient codes, how are you going to do compressions? Fall on them." A few interns snickered near the break room. Thorne beamed at his audience. "I manage," Alara said softly. "You exist," Thorne corrected. "I'm putting you on notice, Vance. The board has approved a new physical competency protocol for all trauma staff. Next Friday, you pass the obstacle course or you pack your bags. We need thoroughbreds here, not plow horses." He turned on his heel, his expensive loafers squeaking on the linoleum. "Clean up the coffee spill in the waiting room on your way out, Vance, since you're moving at a janitorial pace anyway." Alara stood still for a moment. Her hand, scarred and rough, tightened on the handle of the crash cart until her knuckles turned white. A phantom pain, sharp and electric, shot from the base of her spine down to her left heel. A reminder of a life Thorne knew nothing about. "I'll help you, Alara," Mia whispered, rushing to her side. "No," Alara said, her voice steady again. "Go to Bay 6. That patient needs you." I have work to do. Click, drag, thud. She began to move again, the anchor that refused to sink. Chapter 2. The Ghost of the Desert. That night, the rain lashed against the windows of Alara's small, ground-floor apartment. She sat on the edge of her bed, the air thick with the smell of tiger balm and old books. Removing the brace was a ritual of agony. She unbuckled the straps around her thigh, then the heavy Velcro around her waist. With a hiss of breath, she peeled the rigid carbon fiber shell away from her skin. Beneath it, her body was a roadmap of violence. A thick, jagged scar ran from her left hip, twisting up her spine like a lightning bolt. The flesh was puckered, white and angry even after 8 years. Her pelvis had been reconstructed with titanium. 3 vertebrae were fused. She tossed the brace onto the chair and reached for the bottle of whiskey on the nightstand. She didn't drink to get drunk. She drank to dull the noise. Not the noise of the traffic outside, but the noise in her head. The scream of turbines. The smell of burning jet fuel. The heat. Alara closed her eyes, and suddenly, she wasn't in Chicago. She was in the Syrian desert, 2017. Flashback. The MH-60 Black Hawk was spinning. The tail rotor was gone, sheared off by a lucky RPG shot from the ridge. The world was a blur of warning lights and the terrified shouts of men who were trained never to show fear. Brace! 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 The pilot screamed. Alara Vance, then a lieutenant commander in the Navy Nurse Corps attached to a Joint Special Operations Task Force, didn't brace for herself. She unbuckled. Across from her, a young operator, call sign Rookie, was jammed against the fuselage, his harness stuck. He was 22, the same age as Alara's nephew. Get down, ma'am, the team leader roared. Alara threw herself across the cabin, wrapping her body over Rookie just as the helicopter slammed into the hard-packed earth. The impact was the sound of the world ending. Metal screamed. The floor buckled. Alara felt a crushing weight slam into her lower back, the transmission housing collapsing into the cabin. Crack. She couldn't feel her legs. She couldn't feel anything but the wet heat of blood, her own, and others. Then came the fire. She remembered dragging herself. Not walking, dragging, pulling Rookie out of the burning wreckage by his plate carrier, inch by agonizing inch, while her own broken bones ground together like mortar and pestle. She remembered the gunfire erupting around them, the team forming a perimeter. She remembered looking up at the team leader, a man whose face was obscured by dust and blood, and handing him a tourniquet with shaking hands before the darkness took her. End flashback. Alara opened her eyes. She took a sip of whiskey. The glass trembled in her hand. Physical competency, she whispered to the empty room. Thorn wants to see if I can run. She looked at the brace. She couldn't run. Not anymore. But Thorn didn't understand that running wasn't the only way to fight. Chapter 3. The Impossible Standard. Friday arrived with the humidity of a sauna. The hospital gymnasium, usually reserved for physical therapy, had been converted into Thorn's personal coliseum. Dr. Julian Thorn stood with a clipboard, flanked by the HR director, a nervous woman named Mrs. Gable. A dozen staff members watched from the sidelines, nurses, orderlies, and a few curious doctors. They looked like spectators at an execution. The parameters are simple, Thorn announced, his voice echoing in the large room. Simulate a combat extraction scenario, a standard requirement for modern trauma centers. Sprint 50 yards, lift a 50-pound sandbag, carry it 20 yards, and perform 2 minutes of high-quality CPR. He looked at Alara, who stood in her oversized gray tracksuit, the outline of her brace visible. Standard time is 4 minutes, Thorn smiled thinly. You may begin when you are ready, Nurse Vance. Mia, standing on the sidelines, looked like she was about to cry. This is illegal, she whispered to Arthur, the 60-year-old janitor who was leaning on his mop. It's a setup, Arthur grunted. Arthur was a Vietnam vet. He knew an ambush when he saw one. He knows she can't sprint. Alara stepped up to the line. She took a deep breath. She didn't look at Thorn. She looked at the finish line. Go! Thorne barked. Alara didn't sprint. She lurched. She threw her right leg forward and dragged the left. A heavy, rhythmic gallop. Thud step. Thud step. Tick-tock, Vance. Thorne called out. My grandmother moves faster. And she's been dead for 10 years. Alara reached the sandbag. 50 pounds. For a woman with a fused spine, it should have been impossible. She squatted, not bending her back, and gripped the handles. She let out a guttural roar, a sound of pure, raw effort, and hoisted the bag to her chest. Her face went red. Veins popped in her neck. The pain was a white-hot spear driving through her pelvis. She moved. Step, drag, step, drag. The room was silent. No one laughed. The sheer force of will radiating from the small woman was terrifying. She dropped the bag at the CPR station. She fell to her knees, not gracefully, but with a heavy impact. She positioned her hands over the dummy. Compression rate, 100 to 120, she whispered. She began to pump. Her form was perfect. Her depth was consistent. She didn't use her back. She used her body weight, rocking from the hips, overriding the agony with discipline. Time! Thorne yelled. Alara stopped. She slumped back on her heels, gasping for air, sweat dripping from her nose onto the gym floor. Thorne looked at his stopwatch. He smirked. For minutes and 12 seconds, he announced. You failed, Vance. Too slow. Mrs. Gable cleared her throat. Dr. Thorne, technically, 12 seconds is within the margin of precision, Mrs. Gable. Thorne snapped. In trauma, 12 seconds is a lifetime. 12 seconds is brain death. She failed. He walked over to Alara, who was struggling to stand. He didn't offer a hand. He leaned down, whispering so only she could hear. You're obsolete, Vance. A broken toy. Do the honorable thing and resign before I have security escort you out for endangering patients. Alara gripped the side of the dummy to pull herself up. She looked Thorne in the eye. I will leave when my shift ends, Doctor. Not a minute before. Fine. Thorne straightened up. You're on administrative probation effective immediately. You are restricted to minor duties. No trauma bays. No codes. You change bedpans until I process your termination paperwork on Monday. He walked away, feeling like a god. Alara stood up. She wiped the sweat from her eyes. Mia ran over to hug her, but Alara gently pushed her away. I'm fine, Alara lied. She wasn't fine. She was burning alive. Chapter 4. The sky falls down. Monday morning. The atmosphere in the ER was manic. A multi-car pileup on I-90 had flooded the bays with fractures and lacerations. Alara was in the supply closet counting gauze pads, the humiliating task Thorne had assigned her. She could hear the chaos outside, the rhythm of the trauma team, a dance she was no longer allowed to join. Suddenly, the red phone at the central desk rang. It wasn't the normal EMS line. It was the secure line, the one that connected directly to the Department of Defense and federal agencies. It hadn't rung in 3 years. Mia picked it up. Her face went pale. She handed the receiver to Thorne. Thorne here, he said, impatient. Make it quick. I have a femur fracture in. He stopped. His eyes widened. Repeat that? Who? ETA? He slammed the phone down. Clear Bay 1 and 2. Now, move the fracture to the hallway. I want full security protocol. Code Black. What's happening? A resident asked. VIP inbound, Thorne shouted, his voice cracking with a mix of fear and excitement. Chopper transport. High-value target. Massive trauma. We have 3 minutes. A low thrumming sound began to vibrate the ceiling tiles. It grew louder, a deep, chest-thumping whump-whump-whump that Alara felt in her bones. Black Hawk. Alara dropped the box of gauze. She limped out of the closet. Vance! Thorne spotted her. Stay out of the way. Go to the waiting room. I don't want the VIP seeing a cripple the moment they roll in. Optics. Vance. Optics. Alara ignored him. She moved to the edge of the hallway, pressing herself against the wall. The automatic doors blew open, not from a sensor, but kicked open by men in black tactical gear. They held rifles Mk-18s with suppressors. They moved like water, flowing into the room, scanning corners, securing the perimeter. "Nobody moves!" one of the operators shouted. "Medical staff only." Then came the gurney. It was surrounded by 4 men, massive men, beards, tattoos, oak tree arms. They weren't just soldiers. They were Tier 1 operators. But on the gurney lay an older man, maybe 60, in a torn suit. His face was a mask of blood. He was thrashing, choking. "Airway is compromised," the lead operator shouted. He was a giant, standing 6'4", with a scar running through his left eyebrow. "He took shrapnel to the neck. He can't breathe." Thorne stepped forward, smoothing his hair. "I am Dr. Thorne, chief of—" "I don't care if you're the Pope," the giant roared. "Save him. This is General Marcus Halloway, chairman of the Joint Chiefs. If he dies, I will burn this building down." Thorne paled. The stakes had just gone from lawsuit to national security incident. "Get him to Trauma 1, Thorne ordered. They wheeled the general in. The energy in the room was suffocating. The monitors were screaming. Oxygen saturation, 70%. Heart rate, 160. Suction. Thorne yelled. "I can't see the cords. Too much blood." He shoved the laryngoscope into the general's mouth. The patient gagged and bucked, blood spraying onto Thorne's pristine coat. "Sedate him. Push 100 of rock." Thorne screamed. "BP is crashing," a nurse yelled. 80/50. "I can't intubate." Thorne panicked. He was trembling. This wasn't a textbook case. The anatomy was destroyed. The general's throat was a mess of hamburger meat and cartilage. "The airway is gone. I can't get the tube in. Sats are 60%. The giant, the team leader, stepped into the trauma bay, his rifle hanging on his sling. "Do something, Doc. He's turning blue." Thorne froze. The algorithm had failed. He couldn't intubate. He couldn't ventilate. The can't intubate, can't ventilate scenario was a doctor's nightmare, and Thorne was living it. He stared at the bubbling blood, paralyzed by the fear of killing a 4-star general. I need to call anesthesia," Thorne stammered. "We need a fiber optic scope." "We don't have time," the operator yelled. "He's dying right now." The monitor tone changed. The erratic beeping slowed. Beep, beep, beep. Bradycardia. The heart was stopping from lack of oxygen. Thorne dropped the laryngoscope. He stepped back, hands raised in surrender. "It's too much damage. He's gone. Move." The word was quiet, but it carried the weight of a sledgehammer. Alara Vance shoved Thorne aside. She didn't limp this time. She surged, fueled by an adrenaline dump that overrode the pain signals in her spine. "What are you doing?" Thorne shrieked. "Security. Get her out. She's a janitor." One of the tactical operators raised his rifle toward Alara. "Back off, lady." Alara didn't look at the gun. She looked at the general. She looked at the blue tint of his lips. She looked at the lead operator, the giant. "His airway is crushed," Alara barked. Her voice had changed. The rasp was gone, replaced by the commanding snap of a field officer. "Intubation is impossible. If I don't establish a surgical airway in 10 seconds, he is dead. Do you want to shoot me? Or do you want me to save your general?" The giant hesitated. He looked into Alara's eyes. He saw something there that he didn't see in Thorne. He saw the switch, the predator stare. "Let her work," the giant ordered, pushing the other operator's rifle down. "She's a nurse," Thorne yelled. "She's not authorized to cut. This is malpractice." Alara ignored him. She didn't wait for a scalpel kit. She grabbed a number 10 blade from the open tray. She didn't have time for lidocaine. She palpated the general's neck, her scarred fingers finding the landmarks instantly through the swelling. Thyroid cartilage, cricoid cartilage, the membrane between them, the cricothyroid membrane. "Hold his head," Alara ordered Mia. Mia obeyed instantly. Alara made a vertical incision. Blood welled up. She didn't flinch. She plunged her finger into the hole, dissecting the tissue by feel, ignoring the slick warmth. "Tube," she commanded. She took a size 6 endotracheal tube. With her finger holding the hole open, she guided the tube directly into the trachea. Whoosh! A spray of bloody mist erupted from the tube. "Bag him!" Alara shouted. Mia attached the ambibag and squeezed. The general's chest rose. A beautiful, symmetrical rise. "Sat's coming up!" the monitor nurse cried out. 75%, 85%, 90%. The heart rate stabilized. The blue faded from the general's face. Alara secured the tube, her hands moving with a blurring speed. Taping, suctioning, stabilizing. She grabbed a stethoscope and listened to the lungs. "Clear bilateral sounds," she announced. She finally looked up, wiping blood from her cheek with her shoulder. She locked eyes with the giant. "He's stable. Get him to the OR for reconstruction." The room was silent. Even the monitors seemed to quiet down. Thorne stood in the corner, his mouth open. He looked at the general, alive. He looked at Alara, covered in blood, leaning heavily on the gurney as the adrenaline faded and the pain in her back returned with a vengeance. "You," Thorne whispered, his face twisted from shock into rage. His ego had been shattered in front of the most elite soldiers on the planet. "You assaulted a patient," Thorne yelled, trying to regain control of the narrative. "You performed an unauthorized surgical procedure. You are a nurse, Vance. You are not a surgeon. You nearly killed him." The giant operator turned slowly to face Thorne. "She saved him, document. You gave up." "She got lucky," Thorne spat. "She's reckless. She's fired. Vance, get out. Get out of my hospital. I'll have your license revoked. I'll see you in prison for this." Alara didn't argue. She felt the exhaustion crash over her. She untied her mask. Her hands were shaking now. "I did my job," she said quietly. "Get out." Thorne screamed. Alara grabbed her cane from where she had propped it. She walked past the operators, past Mia who was crying, and limped out of the trauma bay. She walked straight to the locker room, changed into her street clothes, and walked out the back door into the pouring rain. She left her badge on the bench. It was over. Chapter 5, The Wolf at the Door. 2 hours later, Alara was sitting on a park bench 3 blocks from the hospital. The rain soaked her coat, but she didn't feel it. She watched the cars drive by. 30 years of medicine ended because she did the right thing. A black SUV with tinted windows screeched to a halt at the curb. 2 more pulled up behind it. Alara stiffened. She gripped her cane. The doors opened. The operators from the ER stepped out. They weren't wearing masks now. The giant, the team leader, walked toward her. He was wearing multicam pants and a black t-shirt. He didn't look angry. He looked intense. He stopped 3 feet from her. He ignored the rain. "You're hard to find, ma'am," he said. His voice was deep, gravelly. "I'm not hiding," Alara said. "I'm just done." The giant studied her. He looked at the cane. He looked at the way she sat, favoring her left hip. "My name is Commander Gabriel Sterling," he said. "Call sign Ghost. Devgru." Alara nodded. "Alara Vance. Unemployed." "Vance?" Sterling rolled the name around his tongue. "Thorne says you're an incompetent cripple. Says you're a liability. Thorne says a lot of things." "Thorne is an idiot," Sterling said flatly. "But I have a question, Alara. Where did you learn to do a finger thoracostomy and a crick in under 10 seconds? That's not nursing school. That's field medicine. That's combat speed." Alara looked away. "I was Navy. A long time ago." Sterling took a step closer. He pulled a folded piece of paper from his pocket. It was a printout of a personnel file. "I made a call," Sterling said, "to the Pentagon. I asked them to run the name Alara Vance." He unfolded the paper. "Lieutenant Commander Alara Vance, Nurse Corps, attached to JSOC 2012 to 2017. Distinguished Service Medal, Purple Heart, and..." Sterling paused, his eyes widening slightly. "The Navy Cross." He looked at her with a new expression. Pure, unadulterated awe. "You're the angel of Aleppo," he whispered. "The crash. 2017. You pulled 3 operators out of a burning Black Hawk while your own back was broken. You held a perimeter with a 9mm pistol for 2 hours until the QRF arrived." Alara shivered. "I did what I had to do." "You disappeared," Sterling said. "The community, we heard stories. We thought you died in surgery, or retired to a beach somewhere." "I retired to a hospital where I get yelled at for walking too slow," Alara said bitterly. Sterling's jaw tightened. "Does Thorne know?" "No, and he wouldn't care. To him, I'm just a line item on a budget." Sterling turned back to his men. "Boys, open the door." He looked back at Alara. "Get in the car, ma'am." "Where are we going?" "Back to the hospital." Sterling grinned, and it was a terrifying, wolfish grin. "General Holloway is awake. He wants to meet the doctor who saved him. And I think we need to correct the record." "I can't go back there, Gabriel. I was fired." Sterling offered her his hand. "You weren't fired, Commander Vance. You were just on a tactical pause. Let's go take the hill." Chapter 6. The Tribunal. The hospital boardroom was packed. Thorne had called an emergency meeting with the hospital administrator, the chief of surgery, and legal counsel. He was in full damage control mode, spinning a web of lies. "It was a rogue action," Thorne was saying, standing at the head of the table. "Nurse Vance has a history of insubordination and physical incapacity." She panicked. She slashed the patient's throat. "I had to intervene to stabilize the situation. The fact that the general survived is a testament to my supervision, not her butchery." The administrator, Mr. Henderson, nodded nervously. "We need to shield the hospital from liability. If she sues." "She won't sue," Thorne scoffed. "She's a broken old woman. She's probably halfway to a nursing home by now." Bam! The double doors of the boardroom flew open. They didn't just open. They hit the walls with a crack like thunder. Commander Sterling walked in. He was flanked by 4 SEALs. They weren't holding weapons, but their presence was more threatening than any gun. Behind them came Alara Vance. She had dried her hair and straightened her coat. She walked with her cane, thud step, but her head was high. "What is the meaning of this?" Thorne sputtered. "Security. Sit down." "Shut up and listen," Sterling barked. The command was so authoritative that Thorne actually sat down before he realized he had obeyed. Sterling walked to the head of the table. He placed a heavy, velvet-lined box on the mahogany surface. "Gentlemen," Sterling said calmly, "I am Commander Sterling, U.S. Navy SEALs. My team is responsible for the safety of General Holloway." "We are grateful for your service," Mr. Henderson stammered. "But this is a private staff meeting regarding a disciplinary." "This is a briefing," Sterling interrupted, "on the events of this morning." He looked at Thorne. "Dr. Thorne claims he saved the general. Is that correct?" I supervise the airway management," Thorne lied, sweating. "Interesting," Sterling said, "because General Holloway is awake, and he remembers everything. He remembers you dropping the laryngoscope. He remembers you crying about a lawsuit while he was suffocating. And he remembers her." Sterling pointed at Alara. "He remembers the woman who took command when you folded." Thorne stood up, his face red. "She is a nurse. She is a cripple. She has no right." "That cripple," Sterling's voice dropped to a dangerous whisper, "is Lieutenant Commander Alara Vance." Sterling opened the velvet box. Inside lay the Navy Cross, gold and blue, gleaming under the fluorescent lights. "For those of you who don't know," Sterling addressed the board, "this is the Navy Cross, second only to the Medal of Honor. It is awarded for extraordinary heroism in combat." He picked up the medal. "Alara Vance received this for pulling 3 of my brothers out of a burning helicopter in Syria. Her spine was crushed in the crash. Her pelvis was shattered. But she dragged 200-pound men through the sand while taking fire. She is the reason they came home to their families." The room was dead silent. Mr. Henderson's mouth hung open. Sterling turned to Thorne. You called her an anchor. You mocked her limp. Do you know why she limps, Doctor? Thorne couldn't speak. She limps because she carries the weight of the lives she saved. Sterling roared. She broke her body for this country. And she comes here, to serve you, to save your patients. And you treat her like garbage because she doesn't run fast enough for your spreadsheets. Sterling walked up to Alara. He snapped to attention. His heels clicked together. He raised a slow, crisp salute. Commander Vance, Sterling said, his voice thick with emotion. On behalf of the teams, thank you. One by one, the other SEALs snapped to attention and saluted. Alara's eyes filled with tears. For the first time in years, she didn't feel broken. She let go of her cane. She stood as straight as her fused spine would allow. She returned the salute. Ready to serve, Ghost, she whispered. Sterling turned back to Thorne. General Holloway has made a request. He wants to donate a significant sum to this hospital for a new trauma wing. Mr. Henderson brightened. That is wonderful news. There is a condition, Sterling said, staring at Thorne. The general refuses to be treated in a facility led by a coward who puts ego above human life. He demands the immediate resignation of Dr. Thorne. Thorne gasped. You can't do that. I have tenure. I bring in millions. And, Sterling continued, ignoring him, the new wing will be named the Vance Center for Trauma Medicine, and Alara Vance will be appointed Director of Nursing Education. Because frankly, your staff needs to learn from a warrior, not a winner. Mr. Henderson looked at the Navy Cross. He looked at the terrifying men in his boardroom. He looked at the checkbook potential of the chairman of the Joint Chiefs. He looked at Thorne. Julian, Henderson said coldly, give me your badge. What? You can't be serious. Thorne shrieked. You're fired, Julian. Gross negligence. Hostile work environment. Lying to the board. Take your pick. Thorne stood there, stripped of his power, stripped of his dignity. He looked at Alara. He expected her to gloat. He expected her to laugh. But Alara just looked at him with pity. Speed isn't everything, Doctor, she said softly. Sometimes, you just have to stand your ground. Thorne stormed out of the room. In his haste, he tripped over Alara's cane. He scrambled up, red-faced, and ran out the door. No one helped him up. Chapter 7. The New Rhythm. 6 months later. The West Wing was unrecognizable. It was bright, modern, and efficient. Above the double doors, silver letters read, the Vance Center for Combat and Trauma Medicine. Alara Vance stood in the center of the ER. She wasn't wearing scrubs. She was wearing a lab coat with her name embroidered on it. Alara Vance, RN, Director of Education. She still limped. She always would. Click, drag, thud. But no one looked at her with pity anymore. When they heard that sound, the interns straightened their backs. The residents stopped chatting. They knew that sound meant the expert was coming. Mia ran up to her holding a tablet. Director Vance, we have a multi-system trauma inbound. 5 minutes out. Alara nodded. Room 1. Prep the rapid infuser. Get the difficult airway cart. And Mia. Yes, ma'am. Breathe. Slow is smooth. Smooth is fast. Yes, ma'am. Alara watched the team assemble. They moved with purpose. They moved with respect. The automatic doors opened. But it wasn't a patient. It was Gabriel Sterling. He was in his dress blues now. He held a bouquet of flowers. Checking up on my investment, Commander? Alara smiled. Just came to get my blood pressure checked. Sterling grinned. And to tell you that General Holloway is running 5 Burmese shots again. He sends his regards. Tell him to stay off the treadmill. Alara laughed. I will. Sterling looked around the bustling ER. You built a good unit here, Alara. I didn't build it, Alara said, looking at the plaque on the wall that listed the names of her fallen team from 2017. I just hold it down. Like an anchor, Sterling said. Alara smiled. It was a genuine smile, one that reached her eyes. Yeah, she said. Like an anchor. She turned back to the trauma bay as the ambulance sirens wailed in the distance. Her leg hurt, her back ached, but she was exactly where she belonged. Click, drag, thud, the sound of a hero at work.